Hey there. I wanted to talk about something I've seen that's been really surprising to me. I've encountered a lot of people who take antidepressant meds or meds for anxiety, and they've never even seen a counselor or therapist to talk about those things. I really truly believe that counseling should be the first step in getting help. Meds certainly have a place, and they can be incredibly necessary, especially when you're talking about more severe life-threatening conditions. When you're talking about psychosis and schizophrenia and bipolar disorder and some things like that. But for the overwhelming amount of people out there that are having symptoms of depression and anxiety, I really strongly recommend that you see a counselor first to talk about it, because there's a lot you can learn about what your lifestyle is doing to influence these factors that just taking a medication for covers up, kind of like a Band-Aid. The analogy I'll use is I work in the physical therapy world, and if you have knee pain all your life, that's really making it hard for you to get around, or shoulder pain for that matter, and you can't do your job or the things you love, and you're just taking handfuls of ibuprofen every day. Eventually you have to realize maybe there's something I can do to actually fix the root cause of what's going on. And that's why I started this thing called Get PT First, to suggest to people that they see a physical therapist instead of just trying to, grit through it and tough through it and suffer through it and just assuming that's a part of life. Well, I believe the same is true for the mental health side of things. So if you're dealing with those kinds of issues, I know it's incredibly distressing, and I know the thought of therapy can be kind of scary to work through some stuff. Maybe some stuff in your past, maybe some things that you already know that are in your life that you really should change, but you don't want to, and so it's easy to just take a pill. But what I just would suggest again and again in this video, because it's a really good reminder, is do the work. It's tough. It's not easy. Sometimes it'll cost you time and money to do the therapy and the work, but it's really worth it in the long run for your long-term health and well-being. Even if you take medication, I do, there's nothing wrong with that, but continue to do the work through therapy to improve yourself, to eliminate areas in your life that are stressors or triggers in your life that are just otherwise making you miserable. If you're working 60, 70 hours a week, have a really, really stressful job and a rough home life, of course you're going to be feeling depressed and anxious. That's a normal response to a crazy life. That doesn't mean that there's something messed up or wrong with you. Also, if you've just had a lifetime of depression, which I can relate to, know that you're not broken beyond repair, that there's hope and there's help available through medication and counseling. But what it comes down to is I want you to take a big view of life and working towards the best version of you. So that's what I'll leave you with today. Take care.